I was watching TV this morning before I came on, and I saw one group advocating free hearing tests for the 40s and 50s, and another group advocating free bereavement counselling in schools. Nobody's kind of against those things, but when we are spending and taxing and accumulating debt so much, we've got to stop all trying to give each other free stuff.
West Virginia Senator Joe Manchin says we cannot spend our way to a balanced, healthy economy and continue adding to our $30 trillion national debt. Getting inflation under control will require more aggressive action.
The bigger the government, the smaller the citizen.
Because welfare is anti-work and anti-marriage, it inherently harms the very people it was supposed to help, especially children.
What the welfare system and other kinds of governmental programs are doing is paying people to fail. Insofar as they fail, they receive the money. Insofar as they succeed, even to a moderate extent, the money is taken away.
Education and healthcare are some of the most important values we have in the world. The last people you want running it is the government. They have no incentive to make it work well. You don't have a customer relationship. There's no competition. There's no innovation.
The next time a politician proposes a generous new government benefits program, the first question should be, where is the money going to come from to pay for it?
It seems all people want these days is free stuff. They expect the government to solve all their problems. Health, education, housing, jobs, bills, food. There's no area of life government spending hasn't touched. This means lazy and inefficient bureaucrats deciding where your money goes, instead of believing in the power of individuals and the free market. But you're in luck, because here at Unlearning Economics, we've put all the evidence together and found that spending by governments is guilty of, first, making long-term investments in things like universal education, childcare, and healthcare. Second, ensuring the population against risks to their health and standard of living. Wait a minute. That sounds quite good, actually.
It's now common knowledge that our welfare system has itself become a poverty trap.
Hey everyone, let's talk a little bit about social spending and free stuff. When I say free stuff, I mean social spending which is funded by governments and is free at the point of use. But that's less catchy. It's not uncommon for the notion of free stuff to be mocked. During Bernie Sanders' presidential campaign, you probably heard a lot of, oh yeah, and maybe everyone should get a pony too. Let's put aside that buying everyone a pony is relatively affordable, coming to at most 15% of existing government spending in the USA, or 1/3 of the defense budget. The question being asked here is a fair one. How will we pay for it? The argument against social spending goes something like this. Surely, we can't just promise free stuff to people, because it has to be paid for somewhere, with taxes, which will only drag down growth, or with government borrowing, which will only indebt future generations. Getting free stuff will also engineer a culture of dependency where no one works for anything any goddamn more. Plus, it's just like the Soviet Union or something. If this were true, you would expect spending on things like education, health, welfare, housing, and childcare to be associated with a whole host of negative outcomes. It could be that social spending is a drag on GDP growth because governments are so wasteful and inefficient and taxes are so high. It could be that social spending reduces employment because people are incentivized not to work by all the free money. Ultimately, high government spending might lead to shorter, stupider, and unhappier lives for everyone down the line. In his book, Making Social Spending Work, Peter Lindert reviews the evidence and finds virtually nothing to support these contentions. Social spending has achieved massive gains in literacy, health, and reducing poverty the world over. In almost every case, there is a notable absence of negative effects on growth, employment, life, and happiness. Let's take a look at this data in more depth, and I guess this is where things get a bit intense. This is what my videos are like, okay? This table shows how various measures of GDP growth correlate with social spending over different time periods in 21 OECD countries, that is, rich countries. The rows show the time period. For example, the first row is the 1960s and the second is the 1970s. The columns show the three different measures. First, growth rates of GDP per person each year. Second, the overall level of GDP per person each year. And third, the overall level of GDP per person at the end of the decade. While the first column measures changes in GDP, the latter two columns measure the total amount. And while the first two columns are done on a year-by-year basis, the third one is supposed to measure the cumulative effect over a decade. The little a's and b's are important because they indicate if the correlations are statistically significant. For instance, the correlation between social spending and the GDP level in the same year for the 1990s is plus 0.47 and is statistically significant with 95% confidence. For the 1960s, the correlation between social spending and the GDP level by the end of the decade is plus 0.65 and is again statistically significant, this time with 99% confidence. The correlation between GDP growth and social spending from 2007 to 2014 is minus 0.09 and is not statistically significant. In fact, looking first at the column for GDP growth rates, you can see that none of the correlations are statistically significant. The values are slightly negative on average, but this is likely just noise. It seems that the growth of GDP and social spending do not have an obvious relationship from this data. Looking at the second and third columns, we can see that the correlations are universally positive, and many of them are statistically significant. This implies that social spending has a positive relationship with the overall GDP level, both on a year-by-year basis and on a decade-by-decade basis. I wouldn't read too much into this positive effect, though. The important point is that the purported catastrophic negative effects of social spending just aren't easily visible. These are just simple correlations, but if there were a negative correlation between GDP and social spending, I could at least see where critics of social spending got their views from. Even with this low bar, there are just no obvious negative effects or examples of it holding countries back. This remains true if you try to correlate social spending with employment levels, self-reported happiness, or play with other measures. Yet investment in healthcare and education has led to longer, happier, and more productive lives for millions of people the world over. Still, this is just a starting point. We'll need to look at more in-depth evidence before we conclude that free stuff is good, actually. By the way, I'll be using free stuff, social spending, and government spending somewhat interchangeably in this video. Governments have a unique role within economies. Unlike private companies, individuals, unions, or even local governments, national governments have a stake in a wide range of social and economic outcomes. This means that spending on education, health, and welfare can have knock-on effects, which ultimately benefit society and the government down the line. In some cases, the eventual benefits will even outweigh the costs of the original spending. Governments are also uniquely positioned to fund such programs and distribute them to the entire population, free at the point of use. At the start of the video, I said there are two main reasons to love social spending. First, it makes long-term investments in things like universal education, childcare, and healthcare on a scale that the private sector won't. Secondly, it provides social insurance for the population against risks to their health and standard of living more generally. It does this in a more efficient and comprehensive way than the private sector can. Let's explore each of these in turn. I'm going to use three main examples of social spending: education, healthcare, and welfare payments like universal basic income. And we're going to do things in that order. So yes, this video has quite a lot of content, but there are plenty of Simpsons clips to break it up.
Have some money.
In 1807, a bill to extend education to the poor was proposed in UK Parliament. The Tory MP, Davies Giddy, spoke out against it.
Giving education to the labouring classes of the poor would, in effect, be found to be prejudicial to their morals and happiness. It would teach them to despise their lot in life, instead of making them good servants in agriculture and other laborious employments to which their rank in society had destined them. Instead of teaching them subordination, it would render them factious and refractory, as was evident in the manufacturing counties. It would enable them to read seditious pamphlets, vicious books, and publications against Christianity. It would render them insolent to their superiors.
I like how this guy's portrait perfectly fits his political views. That feeling when you take things from the poor, lol. Giddy was right about... Giddy was right about some things. Education allowed workers to leave agriculture and get jobs in manufacturing. It tended to reduce support for Tories, and it probably aided the decline of religion. But he was wrong when he said,
Besides, if the bill were to pass into a law, it would go to burthen the country with a most enormous and incalculable expense, and to load the industrious orders of society with still heavier imposts.
Firstly, the taxes themselves were only 0.2% of national income, an eminently affordable sum. Secondly, estimates from back then show that educating the poor would have been a wise investment which likely paid for itself in the long run. This table shows estimates of the rates of return on schooling for the sons of labourers in Victorian England. These are in percentages, the extra money received from paying for your son's education through their eventual higher earnings. The columns show the different parties who might benefit from this investment. We are most interested in the second column, which shows the rate of return for a private family investing in schooling, and the fourth column, which shows the rate of return for the government investing in schooling. As the table states, the first 3 years of schooling would have achieved signature literacy. Men are called grooms here for some reason, and the dates on the far right are when these grooms started schools as sons. It's a little confusing, but it's cool data, so let's stick with it. A private family investing in 3 years of schooling for its son in 1821 yielded a 19.5% return by 1840 when the son was a grown-up groom. For sons who started school in 1842, the return was 11% by 1868. These boys would benefit massively from having their education invested in, as it increased their future earnings by over 10% in each case. What's also interesting here is the fourth column, which shows the fiscal return to the government. The government could expect a 21.2% rate of return from investing in schooling in 1821 and a 6.5% rate of return for investing in schooling in 1842. This is because higher earnings for the sons meant higher tax income for the government once the sons grew up and became grooms. As the fifth column shows, these rates of return were much higher than government borrowing costs. Education paid for itself, even if the government had to borrow to invest in that education. Education benefited the children who got it and their families, and also benefited the government who paid for it. Davis Giddy was incorrect that this was unaffordable. That's right. A Tory MP was both callous and wrong. I'll give you a minute to process that revelation. You could even say that Davies was giddy to deny education to the masses. I'll show myself out. The economist Milton Friedman used to say, "There's no such thing as a free lunch."
It's the free lunch myth. The belief that somehow or other government can spend money at nobody's expense.
The idea is that if you spend money on something like public education, then you have to pay for it, which involves taxes, which are a drag on the economy. Friedman enjoyed quoting the 19th century economist Friedrich Bastiat.
I don't know how many of you have ever heard of a wonderful description of government that was made by a French economist by the name of Friedrich Bastiat about 150 years ago. He said, "Government is that fiction whereby everybody believes that he can live at the expense of everybody else."
The insight that education can pay for itself reframes our view of public spending. Public education enables people to lead better lives through learning and basic skills. It increases income for individuals and their families. On top of all this, from the perspective of governments, public education pays for itself through higher future taxes, contradicting Friedman's dictum. Peter Lindert presents this simple historical diagram of how investment in education yields returns. In the past, countries lacked the fiscal capacity and political will to use tax money to extend education to the entire population. That's link A on the diagram. As a race, that is, humanity, we managed this much later than we needed to. Selfish elites kept education from the masses for tens or even hundreds of years longer than necessitated by a lack of resources and knowledge. Once we began to spend money on education, the average years of schooling went up. That's link B on the diagram. Once years of schooling went up, so did the skills and knowledge of the population, or link C. And once the skills and knowledge of the population increased, so did their productivity and earning power. That's link D. This virtuous cycle also meant higher tax revenues for the governments that invested in the first place. We found the free lunch. All we needed to do was ensure universal provision of education to children. And if you think this only applies to early education in Victorian Britain, then you're going to be so embarrassed when I say what I'm about to say right now. It doesn't only apply to early education in Victorian Britain. Could have improved that script, didn't. There are plenty of other examples from across the globe. Lindert highlights that Eastern European countries have roughly similar average incomes to Latin American countries, but due to higher spending on education, they tend to outperform Latin America on test scores. Education in the USA deserves singling out because it lags behind other education systems despite the high average income of the country. It may be the case that low funding is leaving a free lunch on the table for America. As well as not giving many children, disproportionately poor and or non-white, a good chance in life, the low funding per person in the USA could yield dividends if the government chose to invest more. To be clear, there are many other factors at play in US education, including a lack of centralization and standardization, ultra-religious schools, parents not having much choice beyond their local area, and that good old American spirit of sucking.
Don't ask me. I don't know anything. I'm product of American education system. I also build poor quality cars and inferior style electronics.
Oh, they got our number.
So far, I've actually understated the case for investment in education. Primary and secondary school probably pay for themselves by increasing the earnings of the children when they are adults. But they have effects beyond this. Education can improve health, reduce criminality, and generally facilitate a modern society. As a wise man once put it,
a stable and democratic society is impossible without widespread acceptance of some common set of values and without a minimum degree of literacy and knowledge on the part of most citizens. Education contributes to both. In consequence, the gain from the education of a child accrues not only to the child or his parents, but to other members of the society. The education of my child contributes to other people's welfare by promoting a stable and democratic society. Yet it is not feasible to identify the particular individuals or families benefited, or the money value of the benefit, and so to charge for the services rendered. There is, therefore, a significant neighbourhood effect.
You said it, brother. Wait, you said that? There are lots of ways of thinking about this, but the dominant way is positive externalities. These are sometimes called spillover effects or neighbourhood effects, as Friedman called them. Positive externalities are cases where there are benefits to economic activity beyond the original buyers and sellers. They may sound good because positive is a good word, but actually they can lead to problems. The issue is that because so many of these benefits are spread out across society, they seem invisible or impossible to calculate. As highlighted by Friedman, universal public education has myriad positive externalities. For example, knowing that anyone you try to hire or who tries to hire you will have basic numerical skills and will speak and write fluently is invaluable. If we rely on market mechanisms, education is likely to be underprovided because of the invisibility of this broad social return. Historically, it just hasn't been profitable to provide a basic minimum of education for everyone. We therefore need provision or subsidization of positive externalities like education if we want to have enough of them. There's an extremely interesting study by Hendren and Sprung which reviews social spending policies in the USA. We're going to keep coming back to this study, so remember it, because it demonstrates about as definitively as possible that social spending can achieve the broad benefits we're talking about in this video. Social spending like this makes long-term investments and harnesses positive externalities. And one of Hendren and Sprung findings is that investments in education pay for themselves over a wide range of ages. Here are 3 examples. First, the peri-preschool program, which targeted young children from disadvantaged African-American backgrounds. This was a high-quality program with a high teacher-student ratio and had massive positive effects on later life outcomes, including education, income, criminal activity, and health. It was also a randomized study, which means the effects were likely to be causal. Second, the increases in funding per pupil for schools at K-12 level. This is kindergarten up to year 12, in other words, standard schooling years. A 70s and 80s campaign tried to equalize funding between schools by redistributing from wealthy areas to poorer areas. The results were improved school quality, teacher-student ratios, and pay for teachers. The pupils went on to earn more and experience lower rates of poverty. Third, A policy which admitted an extra student to Florida International University instead of community college. Seriously, no shade to community college, but we know that university probably pays off better in terms of earnings. Despite the fact that going to university increased the time before the student started earning, and also cost more to teach compared to community college, the policy had eventual benefits for the student through earnings and was a net positive to the government through taxes. Investing in early education, school, and even some university education can have a wide range of positive benefits. There's also a broader point to be made here, about the importance of investment in not just schools, but in children more generally.
Think of the children!
Policies to help children can include paid parental leave, childcare, early childhood nutrition, and so on. All these programs seem to hold massive payoffs, probably even paying for themselves over the long run. As Lindert puts it,
the younger the person, the greater the long-run social return on society's investments in them, both on the average and at the still unexploited margin. For any given total public social spending, investing in child development, not least preschool children, is more pro-growth and pro-equality than spending the same amount on public pensions for the well-off or on transfers favoring the rich. Generations of powerful groups in many countries have selfishly failed to heed this lesson from history.
Feminist groups have long pointed out the analogy to investment in physical infrastructure. We have accepted for a long time that investing in roads, railways, and airports can yield long-term dividends. The initial big expenditure justifies itself through higher long-term growth and productivity. The same applies to people and especially children. If they are properly cared for, fed, clothed, and educated, they will be more productive over the long term. I want to stress that making people more productive over the long term isn't the only reason to invest in these things. We may want education because it allows people to engage with the world around them, to grow as individuals, and to become better citizens. My claim is that the economic argument against doing these things falls apart in an extreme way, because in many cases, they pay for themselves. We are leaving the free lunch on the table by not doing them, on top of all the other good they do. There is literally no excuse. On top of being good, it turns out free stuff is quite popular, actually. Recent polling showed that most people in the USA oppose cuts to Social Security and Medicare, two programs which are mostly geared towards helping older people. On the website Ground News, they tell you the blind spots of the left, the right, and the centre, and this story was among the blind spots for the right. Right-wingers would have missed it entirely. Social Security and Medicare are due to run out of money in the early 2030s, a related but separate story which raises different questions about how we continue to fund free stuff. Now this one, curiously, was reported by the right, but not the fact that the same poll from earlier also shows that most Americans support higher taxes to keep these programs funded. These polls were again a big blind spot for the right. And you can see how imbalances in reporting might impact public perception on this issue, driving the left and the right further apart. This is why I use Ground News to do my research. It really helps you develop a more sophisticated understanding of media bias and manipulation by showing you who's covering a story and why. Subscribe using the link ground.news/Unlearning Economics to support this channel and to gain access to an independent news organisation which is working to address our polarised political climate. If I had to summarise the typical comments I get on my videos, the top few would be something like,
"You're British."
"Please debate
"Communists suck."
"Economists suck."
In Chapter 1 of Capital, Marx lays out,
"Please do a video about healthcare."
So, this is me doing part of a video about one main aspect of healthcare. Specifically, we're going to spend a fair amount of time on the implications of healthcare for social spending. I'm going to tell you why it should be on the list of free stuff: universal, publicly funded in at least some ways, and free at the point of use. I'm not going to analyse pharmaceutical companies or solve all of the problems in the US health system, although we will talk about the latter in the next section. In a way, public health is the mother of all positive externalities. There are massive human and economic gains to governments investing in these things, and individually we either can't or won't do it on a big scale. When a disease sweeps through a population, many of our actions suddenly take on new meaning because they affect everyone else. The pandemic has taught us how interconnected we are and how failing to have vaccines or other preventative measures will result in massive costs down the line. Hey, You know who also acknowledged this? Milton Friedman.
There is room for some public health activities to prevent contagion.
The truth is that many efforts to maintain public health are just better done collectively. According to Peter Lindert, people first started to realize this in the 19th century.
An understanding that cholera and typhoid spread through polluted water came in the 1850s. Shortly afterwards, scientists confirmed that bacterial and viral pathogens caused diseases. Vaccines to prevent infectious diseases arrived in the 1890s. Then, public health campaigns became commonplace in the United Kingdom and United States, where people were taught the importance of washing hands and disinfecting water, among other lifestyle changes, to prevent the spread of disease. State and local governments played a critical role by promoting health campaigns, cleaning the water supply, and building sewage facilities.
More recently, the turnaround in the country of Rwanda shows the benefits of investment in public health most starkly. As I'm talking about Rwanda, content warning for extreme violence. I'm not going to go into detail, but I will describe the background history, so be warned and go to here to skip the whole thing. In 1994, Rwanda saw one of the worst genocides in history. Ethnic cleansing against the Tutsis led to the deaths of 1 million people, while the world basically did nothing. As tragic as the initial violence was, the genocide had similarly awful, long-lasting effects. During the genocide, 250,000 women were estimated to have been raped. There was a massive resultant spread of HIV, which was actually used as a weapon. There was also an epidemic of cholera in the refugee camps and low rates of vaccination against measles and polio, all of which led to the highest infant mortality rate in the world. For years after, many saw Rwanda as a basket case. Starting in 2004, the new government created a plan called Vision 2020 to try and become a middle-income country by that date. This may have been a lofty goal, but they did a pretty good job. One factor in Rwanda's success was its massive investment in health to combat the problems created during the genocide. Rwanda dedicated over 20% of government expenditure to public health, which was over 10% of their GDP. You can see the success of this investment most clearly from what happened with HIV and with the antiretroviral treatment ART. On this graph, the red line shows the rate of AIDS-related deaths over time, which rose just before the genocide, reached almost 300 per 100,000 people, but plateaued and started to fall following the new policy in 2004. The blue line shows the number of people on ART, which clearly starts to rise just before HIV deaths start to fall. Over this period, AIDS-related mortality fell by 80%, while new infections fell by 60%, and total prevalence of the virus halved. The gains in HIV treatment are illustrative of the success of Rwanda's public health interventions, but they're only one part of it. These days, 97% of Rwandan children are vaccinated against 10 different diseases: polio, measles, tetanus, and so on. Life expectancy increased from 33 years in 1990 to 63 years in 2012. Infant mortality was the highest in the world, but it has moved up 50 places in the rankings and is now a third of what it was. The important thing is not just that these things are enormous achievements in themselves. They also did not seem to come at a prohibitive cost or have negative effects on growth. Rwanda's GDP per capita tripled during this period, and public debt actually fell. Any notion that investments in health are unaffordable or bad for the economy are belied by these outcomes. If Rwanda can manage universal healthcare, then other poor countries can do it too. I'm going to go out on a limb and say that many of these policies were good for the economy, because frankly, having a disease-ravaged population is clearly not. The positive externalities of addressing these health issues will have showed up in the growth of GDP. The economist Amartya Sen calls universal healthcare the affordable dream, and Rwanda is not the only example. Thailand expanded universal healthcare in the early 2000s and saw enormous progress in life expectancy and child mortality, as well as reducing inequality in these outcomes. Good health was historically for the rich in Thailand, and that's no longer the case. Sen also cites the Indian state of Kerala, which was one of the poorest states but expanded universal healthcare and now has one of the highest per capita incomes in India. Sen gives several good reasons universal healthcare is affordable in poor countries. For a start, there's a lot of low-hanging fruit in these countries. Vaccines, regular checkups, curable diseases, these all cost relatively little for massive health gains. On the other hand, leaving diseases to fester among those who can't afford treatment is just going to lead to massive costs down the line. As anyone who works in health or who has ever heard a saying knows, prevention is better than cure. You can treat someone with cheap, standard antibiotics now, so they don't need an emergency operation to remove their leg in the future. Not having universal preventative care will cost the health system more in crisis care down the line, not to mention the loss in productivity which is felt elsewhere in the economy. By the way, again, I hope you don't think I'm being callous by focusing on costs and economic effects. What I'm trying to get at, as with education, is that the economic argument against universal healthcare in poor countries falls apart even on its own terms. On top of doing, frankly, unimaginable good for the poorest in the world, basic universal healthcare creates favourable conditions under which people, and therefore the economy, can thrive. These effects are most noticeable in poorer countries, which are moving from virtually no care to basic levels of care. The poor within these countries cannot afford treatment at all, so when healthcare is extended to them, there are clear and long-lasting benefits. Just catering to the rich within a poor country means that you miss all of this low-hanging fruit. It is actually more effective in terms of money per health outcome to redistribute some, more expensive care away from the rich within a country towards basic care for those in need. As Sen puts it,
how much healthcare can be provided to all may depend on the country's economic means, but whatever is affordable within a country's means can still be more effectively and more equitably provided through universal coverage.
The Hendren and Sprung Kaiser paper we discussed earlier in the context of education also finds that investments in healthcare for children may pay for themselves over the long run.
Won't somebody please think of the children?
They look at an expansion of Medicaid in the USA to insure pregnant women and children. This cost well over $3,000 per person and caused some mothers to stop working, costing more in tax revenue. Despite these obvious initial costs to the government, over the child's lifetime they have lower healthcare costs due to better care when they were young. They also earn a lot more, which brings in tax revenue. The result is that the policy has paid for itself by the time the child reaches 36 years old. Along with basic care, preventing contagion, and public sanitation, healthcare for children and pregnant women is the free lunch for healthcare. To sum up the video so far, we can return to our reasons free stuff is good. We've seen governments can extend long-term investments in things like universal education, childcare, and healthcare to entire populations, including those who can't afford them. In doing so, they can achieve massive gains, improving people's lives while not overspending or endangering the economy in any way. In many cases, these investments actually pay for themselves over the long term. Caveats do apply. There are diminishing returns. We can't invest in education or anything else forever and hope it will always pay for itself. We shouldn't guarantee everyone a PhD, and trust me, you don't want one anyway. The biggest payoffs to education occur for primary and secondary schools. We can generalize this lesson to childhood nutrition and care, which pays off more the younger the child. The biggest payoffs to health occur for basic care, as seen in the expansion of universal healthcare in Thailand, Rwanda, and Kerala. Beyond these points, we can't be sure that these things pay for themselves. So we are far from done with healthcare. In richer countries, do we still want universal healthcare provision beyond this basic level? This question takes us directly to the second reason we like free stuff. It insures the population against risks. Social insurance can refer to a wide range of different provisions governments use to ensure their citizens do not fall below a certain standard of living. These can range from unemployment insurance, social security and old age, support for the sick and disabled, childcare, and of course, healthcare. The basic idea is that the government takes on the risks faced by the whole population, and because of the government's size, it is able to pool these risks more effectively than the private sector. The private sector would be reluctant to insure everyone against all of these eventualities, so the state has to step in. Unlike investments in basic health and education, social insurance is unlikely to pay for itself. It will definitely require higher taxes, but countries have to pay for healthcare somehow, and it turns out this is better funded by governments. They can effectively insure the whole population in a way the private sector is unwilling or unable to do. This means that universal healthcare is actually the more efficient option and once again, does not endanger the economy. I know the idea the public sector could be more efficient than the private sector is anathema to some people, but they need to update their views because they're wrong. There are some pretty bad arguments against universal healthcare out there. When you say that everyone should have their healthcare covered, one of the first objections you'll hear is moral hazard. Moral hazard is a common problem for insurance schemes of all kinds. If I know I'm insured, then I may be more likely to take risks as I'm covered if things go wrong. Or so the argument goes. I find the moral hazard argument compelling in some cases. If banks know they're going to be bailed out, they'll take more risks, and if things go wrong, they won't face the downside of these risks. We all know that's a problem in the real world. Healthcare is different. Poor health can have permanent and irreversible effects on a person. Am I just going to walk out into the street without looking because we have universal healthcare in my country?
Dad, no, it says don't walk.
Doesn't matter. They have free healthcare. Whoa, I'm rich!
You could argue that moral hazard applies to my use of treatment, not my incurring of health risks, but it's still impossible for me to just casually decide I want an MRI scan. You can't walk in off the street and buy one like a fucking Big Mac. Under universal healthcare, the decision is still left in the hands of experts, known as doctors. As something of a hypochondriac, though, I do have to admit, there's truth to the idea that payments deter take-up of healthcare. I was at the height of my health anxiety in 2017. If I'd had to pay to go see my GP, I'd have done it less. Then I could have just sat at home, racked with anxiety that I was dying. What a win for private healthcare that would have been. I'm making a serious point here. Higher take-up under universal coverage could be because people were under-consuming healthcare before, rather than because they're over-consuming it now. The evidence is, in fact, mixed on overutilization due to moral hazard versus underutilization for other reasons. This is especially true if market prices are high and insurance markets are not competitive. We know from countless reports that the health insurance industry in the USA, for example, features substantial premiums and loading of costs onto customers. People with horrific industries actively beg bystanders not to phone an ambulance because it's too expensive. There are increasingly ridiculous deductibles like being charged for holding your own baby. All in all, it's more likely people aren't getting healthcare they need than are getting healthcare they don't need. Let's go into a bit more depth on how the health insurance market works or doesn't, so that we can avoid charging people for having babies. At the start of this video, I played a clip of Yaron Brook ranting about universal healthcare in the UK.
Education and healthcare are some of the most important values we have in the world. The last people you want running it is the government. They have no incentive to make it work well. You don't have a customer relationship. There's no competition. There's no innovation.
His rant is just a generic argument for competition and markets that in no way explores the things that make healthcare such a unique service. We can contrast Brook's view somewhat unfairly with a famous 1963 paper on health economics by Kenneth Arrow, which points out healthcare just can't be delivered by traditional market mechanisms. This is unfair because Kenneth Arrow was a genius, whereas, well, healthcare is what's sometimes called a credence good, where it's difficult to judge the quality of what you've received even after you've received it. You probably know the expression, "we did the best we could."
Meredith was hit by a car.
What?
Where? It happened this morning in the parking lot. I took her to the hospital, and the doctors tried to save her life. They did the best that they could, and she is going to be okay.
What is wrong with you? Why did you have to phrase it like that?
There's no way for patients to evaluate whether the doctor has truly done the best they could. A good surgeon who does their best can lose the patient. A rubbish surgeon who slacks off can get lucky. A lot of the time, the outcome of a treatment is outside our control. The result of this is that patients have to trust the doctor. This trust could be attained through professional credentials, hence credence good, or accountability mechanisms, or reputation, or ethical oaths. You know, the kind of things economists don't have. The profit motive can easily undermine trust when it conflicts with the best interests of patients. Doctors could use a treatment because they've been paid to promote it, not because it was the best option. Or they could cut corners just to save costs and make more money. These forces have combined to give healthcare a special status. Most hospitals are non-profit and most medical professions have some form of accreditation and gatekeeping. Arrow points out that even in the absence of mass public provision, healthcare is rarely delivered solely through traditional capitalist companies. It just conflicts too clearly with the profit motive. So that's one reason that non-market forces are often at play in the health sector, but it's a slightly different question to ask whether the state should provide healthcare. My claim is that the state can provide health insurance more efficiently and universally than the private sector. Let's unpack how this works. Health risks are difficult to predict for an individual. You could have an accident, a stroke or a heart attack, or be diagnosed with cancer or multiple sclerosis. You may be aware of some inherited tendencies in your family that place you at higher risk. You will also know you're at higher risk if you eat poorly and don't exercise and live near a coal power plant.
What are you, like 45?
43. I know I look a little older, but that's just because I drink and smoke heavily and work with chemicals and sleep on my face.
But whether and when any of these will manifest as serious health problems is virtually impossible to predict. Healthcare can be extremely expensive, and when the bill arrives, most people just don't have the money out of pocket because they weren't expecting it. The market-based solution to this is insurance. You pay a certain amount on a regular basis, and in return you are covered should anything go wrong. This converts the unpredictable nature of individual health risks into a predictable payment schedule for you. Insurance companies can budget what they spend on healthcare in a way individuals cannot, because the pooling of large amounts of money enables them to pay the costs of treatment reliably and charge customers like you a regular amount. Risks become predictable when there is a big population of people, a basic feature of probabilities. The more people, the more reliable the health costs, which leads to economies of scale and is one reason insurance companies are usually pretty big. Administrative costs fall and payouts become more predictable as the companies grow. This depiction of insurance is, of course, quite idealized, and not just because it assumes the insurance companies are behaving nicely and people can afford it, but this is all related to a subtle problem known as adverse selection. The people who are most likely to want health insurance are those who know they are high risk. This means that insurance companies tend to get the customers they want least, that is, those most likely to make a claim. Often, companies can't screen customers directly for everything. We as individuals are best poised to judge our potential for health problems. Even as screening has become more advanced, overt discrimination has been prevented by law in many richer countries. But the mere fact that someone wants health insurance is a signal that they think they might need it. People who are super healthy are more likely to hold back. This is the adverse selection that we were talking about. High-risk people select into insurance, while low-risk people select out. If the insurance company knows high-risk people are more likely to buy insurance, they will have to make more and higher payouts. This will increase the cost of insurance and therefore its price. But with the price going up, the people with the lowest health risks out of those left will drop out again, knowing they can't justify the price. That leaves an even riskier pool of customers buying insurance. This means more higher claims and higher costs for the insurance company. So they put the price up again, and people drop out again, and the price goes up again, and so on, until the market unravels entirely. This has been called the death spiral of adverse selection, and obviously things rarely get this extreme. In line with Arrow's paper, there are mechanisms checking the death spiral, including but not limited to public provision and regulation, as well as private institutions which combat the problem. The most obvious way to stop the death spiral at its nexus, though, is by providing insurance for everyone, so low-risk customers aren't driven out of the market in the first place. You may be wondering if this is actually what happens in health insurance markets, because it's a stylized model, but it turns out there is evidence for it. You see, adverse selection has an interesting implication. If low-risk people are forced out of health insurance, then compelling this group to buy health insurance somehow will reduce costs, increasing the efficiency of the sector. We can test this implication, and if it's true, it's a good argument for broader, maybe even universal coverage being more efficient. The more people we cover, the lower the average cost per person as we bring low-risk individuals in. This isn't the only argument for universal healthcare, but it does counteract the common arguments that the state is less efficient than the private sector. As the USA is the only rich country without universal healthcare, it provides an opportunity to test what happens when we experiment with public, private, and mixed insurance. This means we can see if adverse selection is a reality. And the idea was tested properly in the US state of Massachusetts, which introduced a reform in 2006, which made people pay a penalty for not getting health insurance. This isn't ideal from a humanitarian or distributive perspective, but it should force people into the market who were not previously in it, potentially limiting adverse selection and therefore testing our theory.
This graph shows the proportion of people enrolled in healthcare over the period of the reform. As it says at the top, the graph is for the so-called individual market, which means health insurance not linked to employers. Simply put, it's people directly buying health insurance for themselves. This is a good chance to observe the kind of behavior predicted by adverse selection. 1 on the y-axis means everyone is insured, while 0.8 means that 80% of people are insured, and so on. The solid black line with dots shows the proportion who are insured outside Massachusetts, and this stays at just under 70% over the whole period. The blue dotted line shows insurance inside Massachusetts, and you can see it increases in the period after the policy was put into law. The grey lines either side of the black and blue lines are just statistical confidence bounds. Don't worry too much about those. As the graph implies, there was a large increase in the number of people insured. There was a 26.5 percentage point rise, or 18,500 new people with health insurance. This suggests that the reform was successful in its main aim. But while this was undoubtedly a great outcome, it's not the only thing we're interested in here. As this graph shows, the insurance premiums paid by people in Massachusetts declined, this time by 23%. This is evidence of adverse selection, since prices falling implies that costs fell, exactly in line with the theory. Don't believe me that lower prices reflect lower costs? Here are the average expenditure claims following the reform. Health claims drop in Massachusetts relative to other places, suggesting lower risk individuals now have insurance. To sum up, charging people for not having insurance seems to have not only increased the number of people insured, but increased the efficiency of healthcare by bringing low risk individuals into the market and therefore reducing costs.
The Massachusetts reform was actually the precursor to the Affordable Care Act passed by Obama in 2010. The ACA used much of the same logic, though it's a more complex and multifaceted policy. It was also thankfully a bit more cuddly, subsidizing people for getting health insurance instead of charging them for not doing so. This is more in line with what we want because it tackles the obvious issue of affordability. But by lowering costs, addressing adverse selection also tackles affordability through the indirect method we saw in Massachusetts. One review of the ACA seemed to conclude that its subsidy elements increased enrollment while reducing prices and costs, in line with adverse selection. To sum up, the strange incentives that plague the health insurance market mean there are good efficiency arguments for compulsory and universal health insurance. It avoids the adverse selection death spiral because low-risk individuals cannot drop out in the first place. Subsidizing healthcare heavily makes it more accessible to the population, while also increasing the efficiency and lowering the costs of the sector. Notice that I haven't made any arguments about whether the state should engage in research and development of pharmaceuticals, run hospitals, or train and hire doctors. All I'm talking about is how people buy their healthcare. This has been called demand-side socialism, and it's compatible with a wide range of different health systems underneath the hood. The important thing is that coverage is universal and publicly funded to realize the benefits we've seen. Providing social insurance through healthcare is a more efficient way of delivering it to the entire population. Now, you might ask why we'd even go through the middleman of insurance. In the UK, we have the National Health Service, or NHS, which directly provides healthcare to everyone, largely free of charge. This has many of the same benefits as public insurance and arguably increases efficiency further by eliminating one organisational layer. We don't have insurance in the UK, we just have healthcare. I've been watching The Sopranos recently and I really enjoyed this moment, which illustrates this point.
I'm a utilization review specialist. I represent your insurance carrier. It's my job, together with your physicians, to see how fast we can get you out of this place and back home. Well, this is good. They've closed your incision and you're ambulatory now, and I see they got the Foley out.
You want to kick me out of here?
Well, a hospital stay costs a lot of money.
My bowels don't work. I'm in pain. I just got operated on, for Christ's sake.
Why is this woman there? Her short-termist outlook is likely to cause further complications in the long term, and presumably, she could be employed somewhere more productive. Anyway, I digress. There may be good historical and political reasons you shouldn't go from a system like the USA's to a system like the UK's. Like I said, I'm not going to get too specific about the US health system. There are lots of reasons that it is the way it is, and I haven't touched most of them in this video, but I will say that they include that good old American spirit of sucking.
Don't worry, Marge. America's healthcare system is second only to Japan, Canada, Sweden, Great Britain, well, all of Europe. But you can thank your lucky stars we don't live in Paraguay.
To reiterate, universal healthcare would have to be financed by taxation. My claim is that universal public provision is both more efficient economically and more effective at delivering healthcare to the whole population. But extending it to the whole population would still entail more government spending in total because you'd be treating people you were not treating before. It's just that simple. Now, exactly which taxes we should increase to finance this and by how much is too big a question for this video. I think I'll just make that a video for my patrons.
On one extreme, you have the laissez-faire, let them all starve approach, and on the other hand, you have the what if we gave everyone free money approach. Obviously, the real solution to these issues lies somewhere in between these two extremes, but that doesn't mean that there isn't value in thinking about how something like this could play out.
I'm not even going to say anything.
I don't think people...
Watch this, Lise. You can actually pinpoint the second when his heart rips in half.
...in these two extremes. But that doesn't mean that there isn't value in thinking about how something like...
So, the YouTube channel Economics Explained has a video about Universal Basic Income, or UBI. I thought maybe I'd do a react video to it for the first time ever, but it was just too long to include in this video, so I'll upload it to my live channel. You saw a little preview just then. Social insurance can be for healthcare, but it can also just be insurance against unemployment, poverty, or hard times in general. The people who really need, say, insurance against unemployment are likely the people who are at higher risk of losing their job. This is a big factor in adverse selection, and historically, private employment insurance has been far less common than private health insurance. In fact, it doesn't really exist. Here's the thing. Literally everything we said about health insurance just now applies to welfare payments, and probably even more so. You know who else acknowledged this? Not Milton Friedman, but similar. The economist Robert Lucas, very much a Chicago free market kind of guy.
Since, with private information, competitively determined arrangements will fall short of complete pooling, this class of models also raises the issue of social insurance, pooling arrangements that are not actuarially sound and hence require support from compulsory taxation. The main elements of Kenneth Auer's analysis of medical insurance are readily transferable to this employment context.
Universal basic income is a perfect case study because it's the epitome of free stuff. It's a guaranteed amount of income per month distributed to every citizen. It is money for nothing, for everyone, on a permanent basis. It's a guaranteed floor under your standard of living. But, is it really feasible? The Economics Explained video says maybe not, but it doesn't really cite any evidence. It goes over some of the basics to a satisfactory standard, but there's nothing, yes, nothing, about the numerous experiments done with cash transfers, which are at the very least close to UBI. One of VE's big concerns is that a UBI will increase inflation. Do they have any evidence to support this argument? Well, not really. At one point they seem to argue that current levels of inflation were caused by the pandemic stimulus and therefore UBI would do something similar.
More money in the economy means more consumption, more investment, and more employment. All other things being equal. But it also means more inflation, which I'm sure a lot of you have been thinking the entire time you've been watching this video. Inflation is honestly the biggest problem with the UBI, bigger even than the problem of how to fund the damn thing. Injecting that much money into the economy outside of a major economic downturn is simply going to cause demand pull inflation.
But, you know, maybe there were some other things going on around this time that restricted supply. The global pandemic and economic lockdowns, ongoing supply chain issues, the Russian invasion of Ukraine and the rise in energy prices. No, let's just vaguely gesture at the stimulus and be done with it. All in all, the Economics Explained video is characterized by fear-mongering about inflation, a complete lack of evidence, and also misses many of the most important and interesting debates surrounding UBI. If you're watching EE, which you probably aren't, then let me show you how to discuss a question like this with honest reference to empirical evidence. One of the big controversies with cash transfers like UBI is whether or not they disincentivize work. The argument's straightforward. If you're paid not to work, you'll do it less. There is less of a need to gain income because you already have it. If working people are taxed more to pay for the UBI, this effect compounds. Now, not only are you getting paid for not working, you're getting paid less if you do work. Why bother working at all? This argument is crucial to the idea that we can't give people free stuff in the form of welfare. If the incentives to work unravel completely, then, the argument goes, we won't have an economy anymore. The counter-argument is that people work for reasons other than money. People work to get a sense of purpose and meaning, as well as to contribute to society and not be lazy layabouts. There are intrinsic gains that people get from their jobs, apart from the extrinsic gain of income. In fact, giving people a floor and stability of living standards may enable them to pursue higher callings, which ultimately benefits them and the economy. This could include education, career changes, childcare, and of course playing Mario Kart.
Hey everyone, Editing UE here. I should say that while everything I've said here is right, there are pro-social motivations to working, and UBI will provide a basic floor under people's standard of living. You still get extra money from working under this scheme, right? If you've got a UBI, but you've still got, wages or whatever other payment you get for working, then there is still an incentive, a financial incentive to work more. So it's just worth underscoring that. And I will talk about that in a little bit in the video when I talk about Thomas Sowell. So we're not talking about no incentives to work whatsoever.
There may be positive externalities from these changes, so welfare payments will be good for the economy, especially if everyone learns to mushroom a blue shell.
Are you mad? Only run from Fed? Touch my watch, where you want get dead? Yo, run up, you might get chef. Yo, run up.
So, there are two main arguments which make two different empirical predictions. If the first is true and UBI enables everyone to be lazy layabouts, then we should see people who receive UBI or similar cash benefits working fewer hours or even dropping out of work altogether. If the second is true and UBI enables people to pursue their real passions, which extend beyond just being paid, then people will not work fewer hours or drop out of their jobs. In this case, there may be positive effects of UBI, such as those on schooling, entrepreneurship, and long-term earnings. The evidence is clear. The second argument is right. A 2018 review of 16 trial programs in countries across the world concluded that 93% showed no meaningful reduction in working hours. Another review of 38 studies of 18 trial programs of UBI found overall increases in hours worked. There were some reductions among groups like the sick and disabled, the old, and women with young children, but these were offset entirely by the increase from everyone else. In other words, there was more work overall, but those who arguably needed to were able to step out of employment. This kind of general overview can hide important nuances in policies and studies, so let's go into more depth. You may have heard of the charity Give Directly, which gives sizable cash transfers to people in poorer countries with no strings attached. They argue that this approach is less paternalistic than other charities, allowing people to do what they want with the money. They also boast that their approach is efficient, with 90 cents going to the people in these countries for every $1 donated. Give Directly randomly choose who gets the money out of their eligible households, which they argue is fair. It also means that statistically, the outcomes of the trial are ideal to study. The only difference between the households that got the money and those that didn't is the money itself, which allows us to know the causal impact the money had with a good degree of certainty. In this case, Give Directly gave the equivalent of $1,000 to 10,000 poor households in rural Kenya. In total, this was about 15% of village income, a massive cash injection. So, there can be no complaints that this wasn't enough money to really have an impact, though I stressed that it was a one-off payment rather than a true income. A comprehensive study of the Kenyan cash transfers investigates their impacts on a wide range of outcomes. One of the first things people say about these transfers is similar to the moral hazard argument with healthcare. You can't just give people free money, they'll spend it on alcohol and cigarettes.
Well, that's their big moral high ground a lot of the time, You don't give these people money. No. They'll just spend it on drink and drugs. Well, what do you think I was going to spend it on?
Actually, there was no impact on what the authors of the study call temptation goods, They did find large increases in spending, but this was mostly on food. The irresponsible bastards. There was also more spending on durables like home maintenance and furniture and vehicles. In line with the studies we discussed earlier, there was an increase in hourly wages, but no decrease in hours worked. And, for Economics Explained, little to no impact on inflation. There may be some slight increases for specific goods in specific locations, but these are 0.2 to 0.3% price increases on average. Remember that the transfer itself was 15% of income for a given village, so any notion that this tiny amount of inflation completely cancels out this gain is hard to believe. These are average results. Did they hide a group of people who massively reduced work or spent all their money on cigarettes? It doesn't seem so. The cash transfer had roughly similar effects on people of different ages, genders, employment status, and so on. There are actually such large effects on the local area that even those who didn't receive the cash transfers experienced comparable gains in income and spending. These quite remarkable positive effects seemed to do the villagers good, as there were positive impacts on the psychological well-being, food security, education, and security from crime. I want to pause here and note the significance of this finding. We are talking about people who are in absolute poverty. We found that there are virtually no negative effects of providing them with the basic money to lift them out of poverty. Evidence-free carping from massive channels like Economics Explained about inflation or whatever else isn't just wrong, it's deeply irresponsible. There is literally no excuse for not having something at least resembling a UBI in poorer countries at this stage, just as there is no excuse for not having basic universal healthcare provision. Things may be different in richer economies though, so let's turn to Canada. Canada has long been a pioneer in experiments with UBI, having carried some out in the 1970s in the city of Manitoba. In typical Canadian style, they did all the legwork of the experiment and then forgot to analyse the results, at least until several decades later, when they were dug up by an organisation called Forget. Forget's studies showed large positive effects on health outcomes, which in turn saved the government money, in line with what we were talking about earlier. In 2017, the province of Ontario experimented with a basic income pilot, giving 4,000 working-age people varying amounts which were usually over 1,000 Canadian dollars. Then, in 2019, they abandoned the policy and also disallowed all evaluation of it. What's going on, Canada? Oh, never mind. Once more, some researchers rescued the pilot by finding the people who received the money and asking them about the effects it had. This may not be quite the shiny causal evidence we had in Kenya, but I like to use different types of evidence. Again, the results were pretty clear. People didn't really drop out of work unless they had a good reason like disability or child rearing. People reported numerous positive effects on physical and mental health. In many cases, the money enabled the recipients to pursue long-term goals like education and training, which resulted in them earning more eventually. One 57-year-old man who had previously been illiterate enrolled in adult education.
I was so happy with myself. I reflected a lot on what I had done. I couldn't believe I was up there getting a picture with the whole class with a certificate in my hand. That was a lot of fun, and the people were very nice. I made a lot of new friends. I'm still trying to get out to the social functions they're having. It was very social and very nice.
The idea of floor under people's standard of living will sap their motivation seems exactly backwards. Another recipient said that before the Ontario UBI, her mental illness
would really cause me to stay in bed or drain me of any will to do anything. When I got basic income, the stress was gone, and it was just easier. Knowing I had a purpose and being able to make a plan because the extra financial resources allowed me to do that does something profound to your mental health.
It's no exaggeration to say that being lifted out of poverty is a transformative event which affects people's lives positively in all sorts of ways. To quote one more participant,
I actually cared about finding a relationship. Nobody wanted to be with me before basic income because I was so miserable and I would always complain and be down and negative. On basic income, I actually found a boyfriend. I was so different. It's not the money per se, but the psychological effect of feeling you are going to be all right.
Unfortunately, these experiments, while not one-off payments, were still short-term and were cut off sooner than hoped. It's difficult to find truly long-term experiments with UBI. Alaska, which is also a province of Canada, has had a basic income for a long time, funded by oil revenues. This is small, just over $1,000 per person per year, but is effectively permanent and has been running for almost 50 years. Studies have found, if anything, positive effects on employment, as well as positive effects on poverty. We do not have ideal evidence. If we had ideal evidence, we'd already have a universal basic income. Among the issues with the existing evidence are, many studies are on small transfers, many studies are on temporary or one-off transfers. What's more, the transfers that are large are often temporary or one-off, like Kenya, and the ones that are permanent are often small, like Alaska. UBI would be both large and permanent, but this is rare. Many studies of cash transfers are conditional and require means testing by education, income, marriage status, or whatever. And studies which are unconditional are not truly universal and only give to certain segments of the population, whether certain regions or just randomly selected households, as in Kenya. On the other hand, we've got no reason to believe that transferring people money actually discourages work or causes inflation. We get small or non-existent effects on these things across a wide range of types and sizes of cash transfers. We get a wide range of positive effects on education, health, and the local community. Even if your standard of evidence is super high, and that does not seem to be the case for Economics Explained, you'd at least have to admit that it's time for us to experiment more with these highly successful policies. At the beginning of this video, I played a clip of Thomas Sowell on welfare, who, to remind you, said,
"What the welfare system and other kinds of governmental programs are doing is paying people to fail. Insofar as they fail, they receive the money. Insofar as they succeed, even to a moderate extent, the money is taken away."
I actually agree with the second half of this. If you provide a basic floor of income but sharply reduce payments when people start to work, you create terrible incentives. Some earlier welfare programs in the USA did have genuine problems because of this. Policies aimed at single mothers effectively had a 100% marginal tax rate. That meant that anything earned above the benefits would immediately be withdrawn, leaving a net gain for the single mothers of precisely $0 from working. It's fair to say that this disincentivizes work. Yet just because these were badly designed welfare policies doesn't mean that support for single mothers is itself bad, which leads me to my last point.
Oh, won't somebody please think of the children?
We can think about unpaid childcare as a pure positive externality. Parents, mostly women, raise children for no direct pay, and the growing child, hopefully, has numerous positive impacts on society when they're an adult. Having children is clearly one of the most fundamental contributions you can make, yet we do not reward it. UBI is a way of subsidizing this work, as well as the other unpaid labor women do, which is both fair and should generally improve the provision of that work. Let's turn to one final welfare policy. Food stamps in the USA. These are vouchers provided by the government which can only be exchanged for food. I'd prefer cash transfers, of course, but food stamps are still effective at reducing poverty. Hendren and Sprung, who we've met a couple of times already, took a look at the adult earnings of children whose parents received food stamps. They found that the policy does reduce parents' earnings, presumably because it enables the parent to stay at home and care for the child. But the initial cost, both of the policy itself and the lost tax revenue from parents not working, is almost entirely offset by the child having higher earnings as an adult. Hendren and Sprung also note that they leave out other impacts of food stamps, such as the child's eventual health and associated costs, so the benefits could actually be higher. The policy almost pays for itself, but it could pay for itself completely. Again, I want to stress that universal basic income and welfare transfers in general won't pay for themselves. Like universal healthcare in rich countries, they would require higher taxation, but in the cases where they support children, they may well pay for themselves over the long term. Now, if you're of libertarian or centrist sympathies and you've made it this far through the video, then first, thanks. But you may be thinking something along the lines of, sure, Unlearning, I accept that things like health and education are unique. They probably have more fundamental effects for people than, say, buying a pack of Pom Bears or eating 11 of them. But the government shouldn't always provide these things. That's unsustainable and is only going to lead to problems down the line. Well, that's a nicely put argument, viewer, and that's a lot of packets of Pom Bears to eat in one sitting. This argument actually reminds me of a lecture I saw by Milton Friedman on the welfare state.
The thing about the welfare state
is that when you start on this route, everything goes fine. To begin with, you are imposing taxes on 90% of the people, small taxes, and are able to give considerable benefits to 10% of the people. But the problem is that as time goes on, more and more people come in and either express a desire or are given a chance at a part of the proceeds. So you gradually get to the position where 50% of the people are providing benefits to other 50% of the people, and then you ultimately get to the position where 100% of the people are paying taxes in order to provide benefits to 100% of the people.
I believe that state provision can create virtuous cycles. We've seen time and again in this video that provision of needs in one area has knock-on positive effects on other areas through the harnessing of positive externalities. Funding education increases earnings but can also reduce crime and improve health problems. Funding health enables people to pursue education and employment, reducing the cost of worse health problems down the line. Alleviating poverty, or even the threat of poverty, through welfare such as universal basic income, seem to have positive knock-on effects on education, health, and the rest of the economy. And of course, helping children on these dimensions yields large dividends, often fully paying for itself.
Think of the children. Won't somebody please think of the children?
These dynamics counteract the kind of vicious spiral Friedman was talking about. Enabling people to do better reduces the chance they'll rely on other government spending while also increasing their earnings and therefore their taxes. We see this most clearly when governments try to implement austerity and the virtuous cycle goes into reverse. Because social problems do not go away when you withdraw funding for them, society and often the government itself ends up picking up the bill. I like to think of this as the lump in the carpet problem. If you push down on a lump in the carpet, then it will simply pop up elsewhere. Likewise, if you reduce government expenditure in certain areas, it will feed back negatively into the rest of the economy and may end up costing the government more. Peter Lindert summarizes how past attempts to withdraw support for the poor failed even on their own terms.
And yet, the 1870s crusade against outdoor relief, with its reliance on the workhouse test, had self-checking effects. The crackdown did succeed in forcing the low-skilled and the poor to choose between incarceration in the workhouse or no relief at all. From 1871 to 1881, the share of the population getting any relief at all dropped by 27%. However, the harsher indoor relief was more expensive per relieved person, because indoor relief required expenditures on the workhouse itself and on employing supervisors and caregivers. In 1872, according to a parliamentary report by the local government board, a family on indoor relief cost the taxpayers 10 shillings a week, whereas a family allowed to receive outdoor relief cost them only 4 shillings a week. Not surprisingly, when one totes up the change in aggregate poor relief expenditures from 1871 to 1881, they declined by only 1% in nominal terms. The aggregate amount spent actually rose by 7.3% in real terms over those years, though slightly slower than total population. The result? A decade of throwing poor people out of relief without saving the taxpayer money.
This was true in the 19th century, and it's true now, with austerity in the UK failing to reduce public debt while creating a whole host of other problems. It has been estimated that cutting £200 million from local public health budgets cost the NHS £1 billion in the long run. Healthcare also spills over into other areas. Mental health has been estimated by the World Health Organization to return spending fourfold because spending now reduces health costs down the line, increases employment rates, reduces crime, and increases productivity. Again, the state is uniquely positioned to harness the benefits of these things, while incurring the costs when they are withdrawn. Because I haven't taken on enough controversial topics in this video, I want to mention the police and content warning for distressing images.
Some of you may have seen this video. It shows a disabled woman in the USA who was deemed to be trespassing in a hospital. The hospital phoned the police on her, so they came to remove her from the grounds. She is clearly in distress and is, in fact, having a stroke. The police repeatedly ignore her pleas, even though she was well aware of what was happening. They just didn't believe her. She was removed from the hospital despite her condition and later died in the back of the police van. I'm not saying direct replicas of this one story are happening all over America, but it illustrates starkly a point I want to make.
In The End of Policing, Alex Vitali talks about police being in areas they shouldn't, schools, hospitals, and the like. Defund the police may be a controversial slogan, but in my opinion, this part shouldn't. You may see this as displacing police from doing more beneficial activities. You may think the money for this policeman could have gone into other public services. Either way, it's difficult to ignore the absurdity of the police being called to escort a woman who is literally having a stroke off hospital grounds instead of her being treated. This speaks to my point that social problems do not go away just because you withdraw funding for them. They end up creating problems down the line. It's horrible, but it's also a false economy. To finish on a more positive note, I want to say that investing in a wide range of human endeavours, even those that don't see an immediate economic return, such as the arts, may have less obvious benefits down the road. This is the invisible and diffuse nature of positive externalities. In UK universities, there has been a big shift away from the arts and towards subject areas like STEM. Every so often there's a big push to get rid of these subjects, which are known as Mickey Mouse degrees in the UK. But as blogger Daniel Davis points out, looking at the return on investment to these programs or the median art student isn't going to do these programs justice. Because every so often, someone comes along who transforms the scene completely.
Basically, if any policy aimed at solving the alleged problem above would work, that's getting rid of Mickey Mouse degrees, it would hit courses in media, film, and creative arts at former polytechnics pretty hard. Specifically, you'd bet against the survival of communication arts at Sheffield Hallam University. But congratulations, Minister. You just zapped the course that brought us Nick Park, Art and Animation, Wallace and Gromit, and the media industry cluster in Bristol. The thing about the arts industries is that they're very hits-driven. Talking about what happens to the median person going into them is always going to massively underestimate the value of the system as a whole.
Nick Park also created Creature Comforts.
Oh, well, the zoos are very important to animals. They're a bit like homes, like nursing homes and for poor animals and people like old people.
Yeah, well, it's reasonably comfortable, I suppose, the space, but, I mean, I've been in more comfortable rooms, yes.
If you try to compare the situations and the environment that you live here with the environment that you live in Brazil, there is a big difference. Here, you live in a very small place with all the technological advances possible. You have everything sorted out, double glazing, you know, your heating and everything in Brazil, but you don't have space. In Brazil, you have space.
You want to take that away? You monster. With all that said, I'm not arguing for 100% state provision across everything in this video. You can still be kind of right-wing about the free stuff if you like. I've ironically quoted Milton Friedman a few times in this video, but of course, he wanted to bring market mechanisms into health and education wherever possible, even if the funding ultimately came from the state. Friedman wanted the government to subsidise school vouchers, which allow parents to basically buy their child's education like any other commodity, using the vouchers to make choices about which schools they would go to. The schools would be partially or wholly run by non-state entities. Evidence on the effectiveness of this policy is mixed, but that's not my point. You can like this more pro-market policy while retaining the idea that education should be funded by the state, as Friedman did. Remember, demand-side socialism. I've also drawn heavily from Peter Lindert's book Making Social Spending Work. Actually, I found it about a third of the way into the scripting process and was like, this is literally the video I'm making. So thank you, Peter. Lindert is very pro-social spending, maybe even more so than me, but he's not closed off to pro-market approaches to public services. He seems to think that Friedman's school vouchers proposal can work when implemented correctly. He also really fucking hates teachers' unions in the USA, and maybe just unions in general. He partially blames unions for the fact that healthcare is tied to employment in the USA, and historically, he may well be right. This video is not about exactly how we deliver the free stuff. It matters first and foremost that the stuff is free. It would be funded and overseen by governments, but could be delivered by a combination of national governments, local governments, the private sector, the charity sector, and the cooperative sector. The exact mixture of these will depend on the time and place, although over time the cooperative sector and therefore socialism will triumph. The UK is a case study in how not to utilise the private sector in the delivery of public services. Giving lucrative contracts away to your posh mates, only for them to completely fail to deliver the service in question, is unsurprisingly not what I'm going for here. On the other hand, Mariana Mazzucato has long spoken about the benefits of public-private partnerships in research and development. A good example is the coronavirus vaccine in the West, which saw successful cooperation of companies like Pfizer and Moderna with governments like the US and UK and even the EU. Anyway, let's do one last recap. There are two main reasons social spending by governments is affordable, does not have noticeable negative effects on the economy, and also delivers huge social gains. First, governments make long-term investments that the private sector doesn't. We saw this in detail with education and with investment in children in general. We saw it with the provision of basic universal healthcare in poorer countries. It also applies to physical infrastructure and to research and development, which we've barely touched on. Second, governments provide social insurance more efficiently than the private sector can. Universal provision against health or employment risks stops the adverse selection death spiral in its tracks, increasing efficiency. It also guarantees people can stay out of poverty and deal with hard times, enabling them to pursue the things they really want, often to the long-term benefit of society and the economy. This applies to welfare payments, to healthcare, and could also apply to other benefits like free housing, which again we didn't have time to touch. These dynamics are why, despite my anarchist sympathies, I've never been able to come out completely against states. We know that states and state-like entities can do horrible things. But I do not see how else to achieve this level of universal provision, which marshals huge amounts of resources to massively improve people's lives. If you've got examples of non-state entities making similar achievements in the past in a way that we can apply now, then I'd genuinely love to hear them. Now, not all government spending is good, clearly, and sometimes austerity in specific areas is needed. Pensions and ageing populations represent a genuine fiscal challenge for most countries in the future. The number of people working is going to fall relative to the number of people dependent on people who are working. The ideal approach to and level of government spending is impossible to say outright. It will vary across time and space and is ultimately something that each country needs to decide democratically. Oh wait, sorry, Ben Shapiro's figured out the correct equation for government spending.
So here is the equation. L equals, and the numerator is S plus, and then it's R times A plus I. Okay, so S in this particular equation represents social solidarity.
We need to stop accepting bad economic arguments against social spending. It is both socially and economically desirable to ensure universal provision of human needs to the whole population. And most importantly, free pom bears for all.
Free stuff is good, actually. Don't believe what you heard about free stuff.
Thanks for watching, everybody, and I hope you enjoyed the video. I certainly enjoyed making it. I have a bit of a cold at the time of recording this, which is about a month after I recorded the actual video. Thank you so much to my patrons who, as usual, being very patient with me while I get this video out. I am getting closer and closer to the day that I do this full time. I'm going to quit my job at some point over summer. When exactly that is depends on a few idiosyncratic factors which are not worth mentioning here. But if you can spare a cup of coffee every month, then please do consider supporting the channel. Thanks to my producer Hobbie for all his very hard work on this video. As usual, he is an excellent editor and supports me in numerous ways that many of you, none of you really see. Thanks also to my animator Grim. He had one animation in this about adverse selection, but it was a long one and a really helpful one. I think that's a key concept, adverse selection. On reflection, I have to critique myself I feel like I could have communicated a little bit better in the video, but at the end of the day, it's never going to be perfect, but it's an interesting, I think, efficiency-based argument for universality. So if you want to look into adverse selection, then please be my guest. So yeah, I think that's everything, and I just saw that in my Worker Democracy video, if you remember that, because I rewatched it just now for some reason. I don't usually watch my own videos, but I rewatched that one. I mentioned that I was going to do a video on free stuff, so that was a year and a half ago, and here's the video on free stuff. And you may remember that once I mentioned that I was going to do a video on Thomas Sowell, and I am. It's not next, but it's after the next one. And the next one's going to be a bit shorter. I'm going to do a little one about planned obsolescence, which I think is quite a fun topic. And it will be a relatively short video, that one. So anyway, now you may want to enjoy the outtake from just after the end of this video, which was where we didn't realise that the camera was still running. The mic's turned off, so it's the camera's own mic, which is why it's such bad audio quality. But basically, it's just me and Hobbie eating pombes. So, you know, if you want to watch that, then stay tuned in.
God damn, these pombes are good.
Mate, pombes are so good. Those tiny little bears, they have no business being that good.
Absolutely no business being this good. Well, the next video, pombes are good, actually. Back it up. I left the camera.